What is the scarring like? Looks like the incisions are pretty big in that picture.
Yes, I would say the trade-off for this surgery are incisions. Typically, this is done with an anchor incision, meaning an incision around the nipple areolar complex, straight down, and then underneath the breast. So an upside down T. But because patients are so happy with the results of having smaller breasts, they don't mind the incision.
Nowadays, there's so many things you can do to cover it up. You can do tattooing,
That's true.
laser.
I have seen some elaborate bra tattoos, usually in breast cancer patients. My breast reduction patients tend not to tattoo over the scars, but you can. And we laser all our incisions at about 4 to 6 weeks after surgery, and then again twice more. So we offer scar cream. We use steri strips over the incisions. And we do a bunch of things to help the incisions heal as nicely as possible. And the idea is that they fade to being nearly invisible over the next year to 2 years.
And is that your only option for, and what if somebody was like, I want the smallest scar possible? Is that your only option for a breast reduction? I know for a lift, there's a couple options, but
Right. So you can do a vertical breast reduction if the patient has large, but not too large. I think once you get beyond a certain size and we measure your breast, there's a bunch of measurements that we do from like your collarbone to your nipple, from your nipple to where your crease is. If those distances are really long, then it's hard to do it with just the lollipop incision. But if you have a smaller breast and we're doing not as large of a reduction, sometimes we can do what we call a lollipop reduction. So around the nipple areolar complex and then straight down. Those are about the only ways to get around it. There is a technique where they just go inframammary crease and then around the nipple areolar complex. So they avoid that straight down incision. But the technique, in order to create that, I think, in my opinion, leaves a very boxy breast. And I think the shape that you get from using a more traditional incision outweighs any advantage of not having that lollipop. And then in older women, you could do a liposuction only breast reduction, which
oh.
are very small incisions. But those patients who will do well with that are very rare. They have to have enough fat in their breasts. So younger patients tend to be more dense breast tissue, so not amenable to liposuction. The older patients have more fat versus breast tissue, so could do liposuction, but then their skin quality maybe not be such that if you do liposuction of the breast, the skin is going to retract.
And what would make the scars harder or easier to heal? Or does everyone's scar the same?
That's a great question. Everyone does not scar the same. I tell patients, I'm going to try to close the incisions under the least amount of tension in multiple layers. We add steri strips. Then we put biocorneum on after the steri strips fall off. So a type of scar cream, if you will, that helps with healing. And then laser the incisions at 4 to 6 weeks. All of that is helping both support your healing and then also help the collagen remodel so that it lays down flat. And then the other thing I forgot to mention earlier is that we do provide everybody with Heal Fast. So it's a vitamin supplementation that they take prior to surgery and afterwards, and just has that array of vitamins to kind of support wound healing as well. And basically everything we can do to optimize that your incisions close and heal and the collagen lays down nice and neat so that you get a nice thin line.